If you are a man over 50 and morning erections have become something that used to happen rather than something that still does, I want to start by telling you something that most doctors never say out loud. This is not inevitable, and it is not irreversible for every man who experiences it. For a meaningful number of men, the overnight vascular process that produces morning erections has not stopped working permanently. It has slowed down because it is missing specific raw materials, and one of the most underappreciated ways to restore those materials is through what you drink in the hour before you go to sleep. Tonight, starting now. I know that sounds like a large promise, and I want to be precise about what I mean. I am not describing a miracle drink that reverses decades of vascular aging in a single evening. I am describing the nutritional biochemistry of the overnight processes your body runs while you sleep, specifically the synthesis of nitric oxide, the regulation of testosterone, and the repair of endothelial tissue. And I am going to show you which drinks actively support those processes and which ones quietly sabotage them. By the end of this video, you will understand the mechanism, you will have a specific bedtime routine, and you will understand exactly what it can and cannot do. That is the kind of information that actually changes outcomes. I'm Dr. Mariana, a urologist with over a decade of clinical experience working with men on the intersection of vascular health, hormonal function, and sexual wellness after 50. What I have learned from thousands of patient conversations is that most men who experience the loss of morning erections have never been told what is actually driving it. They have been told it is age. They have been nodded at sympathetically and sent home. Today, we are going further than that. If you are new to this channel, please subscribe and leave a like. It genuinely helps this content reach the men who need it. And drop a comment below telling me where in the world you are watching from. This community spans more countries than I can name, and I am grateful for every person in it. Let us start with the overnight biology, because everything I am going to recommend flows directly from understanding what your body is actually trying to do while you sleep. Between the hours of roughly 10 at night and 2 in the morning, the body enters its most intensive repair and synthesis window. Growth hormone is released in its largest pulse of the day. Testosterone synthesis ramps up in the Leydig cells. The endothelium, the lining of your blood vessels, conducts its most active repair cycle. And 3 to 5 times across a full night of REM sleep, the autonomic nervous system triggers the vascular relaxation event that produces nocturnal erections. This entire cascade depends on specific biochemical inputs being present in adequate concentrations at the time these processes run. Think of it like a factory that runs its most important production overnight. But if the raw materials were not stocked during the day, the night shift has nothing to work with. The drinks I am going to describe are about stocking that factory before the night shift begins, not after, before. The first drink is warm beetroot, either as a freshly prepared juice or as a teaspoon of high-quality organic beetroot powder dissolved in warm water. The mechanism here is well established and worth understanding clearly. Beetroot is one of the most concentrated dietary sources of inorganic nitrates available. When you consume those nitrates, bacteria on the tongue and in the gut convert them to nitrite, and nitrite is then converted by the body to nitric oxide, the molecule responsible for vascular smooth muscle relaxation. Without adequate nitric oxide, the smooth muscle inside the corpora cavernosa cannot relax. Without that relaxation, blood cannot fill the chambers. Without that filling, no erection occurs, not during intimacy and not overnight during the autonomic cycles that constitute the body's own vascular maintenance routine. Clinical research has demonstrated that dietary nitrate from beetroot produces measurable increases in plasma nitrite, the precursor to nitric oxide, within 2 to 3 hours of consumption, with effects persisting for up to 12 hours. Drinking warm beetroot in the hour before bed means the peak nitrate conversion window aligns with the early overnight REM cycles, when the body most needs it. This is not a supplement stack, this is a vegetable, used intelligently and timed deliberately. 1 teaspoon of beetroot powder in warm water or a small glass of fresh beetroot juice, unsweetened, not from concentrate, 30 to 60 minutes before sleep. The second drink is warm water with magnesium glycinate or magnesium citrate dissolved in it, typically between 200 and 300 milligrams of elemental magnesium. Magnesium is involved in over 300 enzymatic processes, and several of them are directly relevant here. First, magnesium is required for the activation of nitric oxide synthase, the enzyme that produces nitric oxide in the endothelial cells. A body that is magnesium deficient produces less nitric oxide even when dietary nitrate intake is adequate, because the conversion enzyme cannot operate at full capacity without its magnesium cofactor. Second, magnesium regulates the body's stress response by modulating cortisol. Elevated cortisol, which is endemic in chronically stressed or sleep-deprived men, suppresses testosterone synthesis directly. Magnesium taken at night reduces the cortisol load that the body carries into sleep, which means the testosterone synthesis window that opens in early sleep is less impaired. Third, magnesium supports deeper sleep architecture, specifically slow-wave sleep and the transition into REM. Men who are magnesium deficient sleep more lightly, spend less time in the restorative stages, and have blunted growth hormone pulses, all of which reduces the quality of the overnight vascular maintenance cycle. Magnesium glycinate is the preferred form for bedtime use because it is absorbed efficiently, is gentle on the digestive system, and has a mild calming effect that supports sleep onset. It dissolves cleanly in warm water and can be combined with the beetroot powder in a single bedtime drink. I want to pause and ask something directly. Have you ever specifically told a doctor that your morning erections have diminished or stopped and had that doctor respond with anything beyond a sympathetic nod? Drop a comment below, yes or no. I ask because in my clinical experience, this symptom is consistently under-investigated, and I want to understand how universal that experience is for the men in this community. The third drink is tart cherry juice, specifically Montmorency tart cherry, unsweetened, about 150 milliliters in the evening. Tart cherry has accumulated a meaningful body of research around sleep quality, and the mechanism is twofold. It is one of the few significant dietary sources of naturally occurring melatonin, and it contains compounds that inhibit the enzymes responsible for breaking down tryptophan before it can be converted to serotonin and then to melatonin. Better melatonin signaling means faster sleep onset and more complete sleep architecture, including more robust and more frequent REM cycles. And more complete REM cycling directly increases the frequency and duration of nocturnal erections. There is a second reason tart cherry belongs in this conversation. It is one of the most potent naturally occurring anti-inflammatory agents studied in human trials. Chronic systemic inflammation, which is widespread in men over 50 and closely associated with endothelial dysfunction, suppresses nitric oxide production, accelerates vascular aging, and impairs the local immune environment of penile tissue. Reducing that inflammatory burden consistently, night after night, through something as simple as tart cherry juice, supports the vascular health that morning erections depend on. 150 milliliters, unsweetened, combined with your beetroot and magnesium in the bedtime window. This is your evening stack. The fourth point is what to avoid. And I want to be direct about this because the avoidance side of the equation is at least as important as the addition side. Alcohol, consumed within 3 hours of sleep, suppresses REM sleep architecture in a dose-dependent way. Even one drink moves the body toward lighter, less restorative sleep stages and reduces both the frequency and duration of overnight erections. This is not a moral position on alcohol. It is a straightforward description of what alcohol does to the neurological and vascular processes that produce the signal you are trying to restore. Men who are serious about restoring morning erections need to move their evening drink, if they have one, earlier in the evening, and ideally to reduce it significantly during any focused recovery period. Caffeine consumed after 2 in the afternoon has a similar, if milder, effect on sleep architecture in men over 50, whose caffeine metabolism slows with age. And high glycemic foods consumed close to bedtime, the biscuit with tea, the crackers before sleep, produce an insulin spike that suppresses growth hormone release in the early overnight window, directly impairing the hormonal cascade that runs alongside the vascular maintenance cycle. The fifth point is about a specific addition to the bedtime drink that I recommend for men whose zinc levels have been confirmed as insufficient. And as I discussed in a previous video, that includes a larger proportion of men over 60 than most people realize. Zinc, taken at night alongside magnesium, supports the testosterone synthesis that runs overnight, inhibits the aromatase enzyme that converts testosterone to estrogen, and serves as a cofactor for the nitric oxide synthase pathway. 25 to 30 milligrams of zinc bisglycinate or zinc picolinate, the most bioavailable forms, added to the bedtime routine completes what I think of as the overnight vascular support stack. Beetroot for nitric oxide substrate, magnesium for nitric oxide enzyme activation, cortisol regulation, and sleep architecture, tart cherry for melatonin support and inflammation reduction, zinc for testosterone synthesis and hormonal balance. each one addressing a different node of the same underlying system. Together, taken consistently over weeks, they give the body what it needs to run the overnight processes that produce the signal most men have stopped expecting. Let me tell you about James. He was 61 when he came to see me, brought in not by his own concern, but by a conversation his wife had started at home after watching a video about men's cardiovascular health. He was resistant at first. He had not raised this topic with any doctor and had not planned to. He described the loss of morning erections as something he had accepted completely, so completely that he had stopped registering the absence. When I walked him through the overnight biology, the same framework I have shared with you today, something shifted in his posture. He leaned forward. He said, "So it's not just gone, it's being blocked." That reframe mattered to him. We ran a full panel. His magnesium was low, his zinc was borderline, his inflammatory markers were elevated, his testosterone was in the lower quarter of the normal range. We built his bedtime routine. Warm water with beetroot powder and magnesium glycinate, tart cherry juice alongside, zinc bisglycinate, and a deliberate shift of his evening glass of wine to earlier in the day. At his 8-week follow-up, he came in and said simply, "It's coming back." Not fully, not dramatically, gradually and then more consistently. He said the thing that surprised him most was not the physical change itself, but the realization that his body had been waiting for something specific, and that the something specific had not been complicated. He said he wished someone had told him years earlier. I am telling you now. I want to speak to the men watching this who have quietly organized their lives around this absence, who have stopped expecting certain mornings, who have told themselves a story about aging that allowed them to move forward without grieving something they did not have language to grieve. I hear that. That accommodation is not weakness. It is how people survive changes they were not given the tools to address. But I want you to consider something. The tools exist. The biochemistry is understood. The raw materials are available, inexpensive, and do not require a prescription. The question is not whether your body is capable of responding. The question is whether you are willing to give it what it has been missing and wait, with patience and consistency, to find out. 4 weeks, 8 weeks. Give this routine 8 weeks of genuine consistency and pay attention to what your body tells you. Not every man will get the same result, but a significant number of men will get a result that surprises them. You deserve to find out which one you are. Here is your complete action summary. 30 to 60 minutes before sleep, prepare your bedtime drink. Warm water with 1 teaspoon of organic beetroot powder, 200 to 300 milligrams of magnesium glycinate or citrate dissolved in, and 100 to 150 milliliters of unsweetened Montmorency tart cherry juice alongside. Add 25 to 30 milligrams of zinc bisglycinate or picolinate if your zinc levels are low or have not been recently tested. Move any alcohol consumption to earlier in the evening, ideally more than 3 hours before sleep. Avoid caffeine after 2 in the afternoon. Avoid high glycemic foods in the 2 hours before bed. Maintain this routine consistently for a minimum of 8 weeks before evaluating the outcome. Your 30-day challenge is to build this bedtime routine into a non-negotiable habit, the same way brushing your teeth is non-negotiable. Not because 30 days will complete the process, but because 30 days of consistency will build the habit that makes the 8-week window accessible. Start tonight. If this video gave you something real and actionable, please subscribe and leave a like. And in the comments below, I want your answer to one specific question. How long has it been since you experienced a reliable morning erection? You do not need to be precise. A rough time frame is enough. Your honesty helps this community understand that this experience is far more widespread than any man watching this realizes. Aging is not the end of vitality. It is an invitation to live smarter.